Hi, my name is Wanjiko. Welcome to my YouTube channel. If you have not subscribed to this YouTube channel, kindly do so. Remember to hit that like and notification bell. Anytime we upload a new video, you'll be among the first person to be notified. Yeah. Now, in today's topic, we're going to discuss needles. Previously, we had talked about sutures, and another thing I can add, sutures, they have numbers. They have their numbers. Yeah, I will do another detailed video or a combined video between sutures and needles, so stay tuned. Now let me discuss about the needles. Needles, we have there in two types. We have round end and the cutting end. When you talk about, we say a suture is round end. It looks like this. Let me show you. A round end suture has this sign. This one. Yeah. Let me try this sign. That's it's a round-bodied suture. Then we have another design called the cutting suture, which has, you can see the difference. The other one was like a dot, but this one is like a triangle, and I'll further elaborate the different type of this triangle, you see. And when you talk about a needle, it has three parts. A needle, it's usually like this. It has a sharp point here, it has a body, and it has here somewhere we call a swaggered end. This is where this needle and the suture meets. That is where we call it a swaggered body. Now, this round-bodied, there are two types. One is, it has a taper point, and the other end is called a blunt point. A taper point means it's a sharp one. Then blunt point means it's blunt, yeah. And another thing to note about round-bodied suture, they are non-traumatic, and they are usually used for delicate structures such as the bladder and the bowel. Then let us discuss the cutting ends. They have two types. You have the convectional and the reverse cutting. When you say convectional, it's like this. The triangle is inaangalia juu. It's pointing upward, yeah? That means the triangle, its triangle is pointing upward, yeah? This is a convectional. And then when it's facing downward, it means it's a reverse cutting. Let me show you if I can see. We have this one like vicryl rapid. You can see here, its triangle is facing downward, so it means, let me try it. Its triangle is facing downward. Yeah, this triangle. So it means it's a reverse cutting needle. Then we have another one. When it's like this. You can zoom it. This one means it's a multi-pass needle. Can't see one. It's a reverse cutting also. Let me show you. All of them, they are reverse cutting. But when it's this tip of this triangle is facing upward, it's like this. When it's like this, yeah. When you see a triangle like this one facing upward, that means it's a convectional tip, yeah. And when we discuss these cutting needles, they are traumatic, so they pierce. They're usually used to suture tough structures, yeah, like the skin, the sheath. You have maybe the things like rectus sheath, the sheath, and the facial. Adios.